If you deal with shoulder pain, one thing you can do to try to heal this is to do more back and rear delt work. Now, obviously, if you have a serious shoulder injury, this isn't for you. You need to go see a doctor in that case. But whenever I talk to anyone that just has some nagging shoulder pain that slightly annoys them, or that pops up whenever they're trying to lift heavy, 9 times out of 10, they tell me they don't do as much back work as they do for their chest, and they also barely train their rear delts or don't even train them at all. Most people just spend too much time crouched over, and they also use their anterior chain muscles, aka muscles in the front of the body, more than they use their posterior chain muscles in the back. And because of this, most people have underdeveloped posterior chains compared to their anterior chain. So what this means is that when you're training, you need to do more work for the back muscles of your body. And generally speaking, I recommend you do about 1.5 to 2 times the work you do for your back muscles that you do for your front muscles, just because you're using your front muscles more in your day-to-day activity. So for example, if you're training your chest with 8 sets a week, 12 to 16 sets for your back muscle, which is the antagonist for your chest, is a pretty good amount to do. And I would say at minimum 8 to 10 if your chest is underdeveloped. And training rear delts is very important. I recommend you do at least a few sets of rear delts a week. Once you start doing this, you'll notice that you'll have a lot less shoulder issues.